All right. Good evening, everyone. Happy Tuesday. I am Chere M. Goode, the Recharge Strategist, and I am super excited about another session for Mental Health Matters, our free webinar series. Last night was amazing. We had Kiana F. Brown talking to us about forgiveness and healing, and she was absolutely amazing. Let me tell you, we had so many compliments about her session and people saying that they really, really needed that because we all have to forgive others in order to heal. We have to do that self work. We have to make it a choice to forgive others and to heal. Tonight, I have two dynamic professionals in the mental health industry who are going to pour into you. So if you don't have your pen and paper, I just want to tell you, you might want to get it because we're going to share some juicy nuggets about how to manage mental illnesses. So my two guests tonight are Dr. Tiffany Zachary, coming to us live from Louisiana. And then we also have the infamous Ashley Smith, who's an author, and she's going to talk to us about her book. And she's coming to us live from Atlanta, Georgia. So I decided to get mental health professionals from all over. I didn't want just people in the DMV because this is a national issue. Mental illness, mental health, it's imperative. We have to start having those deep, honest hearted conversations so that we can get in the know, we can take the stigmas out about mental illnesses. So tonight, if you have questions, those that are live on the Zoom, if you have questions, please feel free to say hello in the chat to me, ask your questions. I will be looking at the chat, and also our professionals. If you happen to see something in the chat and I may miss it, please let me know. I don't mind. To everybody that's on Facebook Live, good evening. I hope you're going to enjoy this session tonight because we're really going to delve in. So I'm going to get started because we have two ladies we have to talk to. So that means we have a double dose of information we're going to share. I want to shout out some of the people that are on our Zoom Live. Dee Bolden, thank you for coming back again tonight. She was on last night. She's the money lady. If you want to know how to get that money, you got to get with Dee Bolden. And also we have Joanna Samuel. Thank you so much for tuning in on the live Zoom. To everyone on Facebook Live, thank you so much. And Joanna Samuel, I have to mention that she is from St. Croix, Virgin Islands. So this webinar series is definitely making an impact globally. So thank you so much for spending your time with us. We're going to jump right in. I'm going to get our professionals to introduce themselves because they can tell you better about themselves than I ever could. So we're going to start with Dr. Tiffany Zachary. Dr. Zachary, thank you so much. Thank you for tuning in and sharing your wealth of knowledge with us this evening. Tell everybody about you. We already know you're from Louisiana, but tell us a little bit more about
you. Hi, everyone. My name is Dr. Tiffany Zachary. I have my private practice here in Lafayette where I service moms in corporate America. I also
Tiffany,
am an author.
Tiffany, it looks like you're having some technical issues. You were frozen for a minute. So can check your internet connection. You were frozen and you were kind of sounding a little robotish. So I'm gonna come back to you. I'm gonna let Ashley Smith come on and introduce herself, and then we'll come back to you, Dr. Tiffany, because we don't want to miss anything about you. So Ashley Smith, please introduce yourself, tell everyone about you and what it is that you do.
Hi, everybody. My name is Ashley Smith, and I'm the author of Coping Takes Work. I'm a peer living with a mental health diagnosis of schizophrenia and bipolar, otherwise known as schizoaffective disorder. Yes, I do live in Atlanta. Shout out to everybody in the Georgia Peach. I'm also a mother, and I am a self-publishing book writing coach.
Awesome. Thank you so much for joining us from Atlanta. The A is in the building, okay? So thank you so much for spending some time with us this evening. We look forward to hearing about your personal experiences and also about that juicy book you have behind you. But we'll talk about the book later on after we give everybody some juicy nuggets and make them really, really want it. So I'm going to head back over to Dr. Tiffany Zachary, and hopefully we can hear you this time, Dr. Tiffany.
Can you hear me now?
We can.
Okay, I'm sorry about that. Hi, everyone. My name is Dr. Tiffany Zachary. I'm coming from Louisiana. I have my own private practice where I service corporate America, entrepreneurs, and college students. I'm also an author and a speaker and a mother to a 2-year-old. Tonight, I'd like to give you some knowledge on bipolar disorder because, unfortunately, it runs rampant in my family. But I do have a diagnosis of depression and anxiety caused by trauma.
So the one thing that I want to just mention just at the onset is both of you ladies mentioned that you are dealing with mental diagnosis of your own. So mental illnesses, mental disorders don't have a face. Would you both agree to that?
Most
Yeah,
definitely.
definitely. So often we place judgment or we look at somebody and we think we know them, but we really don't know what's going on with somebody on the backside. So I appreciate you both of you being honest and sharing your truths with us. So we're going to talk about that a little more. But first, I just think I want to give a couple tips about not tips, but I want to give a couple pointers about mental illness. So mental illnesses, mental disorders can go from a range of conditions that affect a person's mood, their thinking, their decision making, and even their behaviors. So that's why it's so important that we have this conversation. And some of those symptoms that we'll delve into in a little bit with you are like extreme fatigue. We're not just talking about, oh, you're tired one day or two. We're talking about extreme fatigue where you can't even drag yourself out of the bed. We're talking about extreme fear, extreme sadness, confusion, paranoia, excessive mood swings, insomnia, withdrawal, lack of reality, and then excessive change in your eating habits. These are all some of the symptoms that can occur within mental illnesses. And so tonight we're going to be talking about managing mental disorders and mental illness. So I'm going to start with Dr. Tiffany again, and then we'll come back to you, Ashley, in a second. So let's talk about some of these disorders. I heard Ashley mention um, personality disorder, schizophrenia. What are some of the other disorders that you see in your range of practice?
It's majorly depression, anxiety, with generalized anxiety disorder, bipolar disorder 1 and 2. I have one individual with schizoaffective. I have some PTSD and some autism. A little bit of ADHD, ADHD, but not too much.
Not too much. And especially now because it's wintertime, do you see more cases of depression because we're not getting as much sunlight right now?
Oh, absolutely. And then you also have to take into account the holidays and things like that. For some people, it really doesn't bother them, but down in the South, we're very family oriented, so it plays a big part, especially for my college students who are away from home.
Wow, wow, okay. Now, Ashley, I'm going to come over to you because you mentioned that you actually are managing your own mental disorder. So talk to us about that and tell us how you are managing.
Yes. First of all, schizophrenia is a thought disorder, which is characterized by hallucinations, hearing and seeing things that other people do not experience, extreme paranoia, false beliefs or delusions, and a range of other symptoms. I manage it through my treatment team, which includes my therapist and my psychiatrist. I'm also on medication that does wonders for me, but the most important thing to me is my support system, my therapy, and my livelihood, which keeps me going.
Yes. And then how how important would you say it is to have a normal routine? Talk about that.
It's critical. I have I have an extensive self-care regimen, which I do daily. I walk for 20 minutes to an hour a day. I engage in my writing, which is my journal and my blog, Overcoming Schizophrenia. And
Mhm.
so I'm doing a range of different things, resting, and other things that help keep my energy up so I can do things that I want and need to do for my family and for myself.
Absolutely. Now, Dr. Tiffany, let's talk about, let's say somebody hasn't been diagnosed yet. What are those biggest things that you would say you need to go and see a doctor about, like behaviors or different symptoms that they're having? What are the biggest things that you would say, look, this is a dead giveaway, you definitely need to go see somebody?
Somebody just asked me about that today.
Good, good.
With mood disorders, especially bipolar, it's a given. But people look at bipolar disorders like, oh, your mood is up and down, which is true to a certain extent. But if you feel a lot of sadness it's all about the severity and the frequency of your symptoms. For
Mhm.
instance, major depression, if you have something going on, sadness, irritability, lack of energy and things of that nature for a span of 2 weeks, then and it keep happening, is not something that just an adjustment disorder. And that means that something has happened in your life that's why you're depressed. So you have to pay attention to the frequency and the severity of your symptoms. But the symptoms, there's only maybe 1 or 2 symptoms that will differentiate one diagnosis from another. And like I said, adjustment disorder with depressed mood and major depression is the only difference is the time span that you have those moods.
Okay. And you mentioned too that you have a family history with mental illness and that you suffer from some mental disorders yourself. So talk about that and talk again, like I asked Ashley, what do you do in order to manage your own symptoms so that you're able to live a normal lifestyle? Because obviously you're still successful, and people think that there's a stigma that if you have a mental disorder that you can't function normally, that you can't be on your own. Talk about all of that and talk about how you are managing your own wellness to keep your mental health managed.
I was first diagnosed with depression and anxiety when my brother was murdered my senior year of high school. And that passed. It didn't last, I want to say maybe 6 months. And then maybe because I was a senior in high school, I was on the move. I was focused on going to school and going to law school. But when my father passed away from a massive heart attack, that was just something I couldn't shake back from. And I tried to fight it on my own. I started to have panic attacks while driving. It was just really extreme things. I started to have suicidal thoughts. And people think, you're successful, you have all these degrees, you're financially stable, this and that. But at the time, none of that mattered because I didn't have the mental state to focus on it. I felt lost and incomplete. So I went and spoke to a psychiatrist who I had worked with before, and I trusted him. And that's big. You have to trust who you see, your care provider, therapist, your psychiatrist, because you have to be willing to be open and vulnerable. And he was the one that diagnosed me with depression and anxiety. So right now, I am on medication for my depression and anxiety, especially after having my daughter. She's 2. So being a single mom, that's a whole nother level of stressors. Luckily, my postpartum didn't last long, but I do have some clients who are experiencing it, and their kids are like 2 or 3 years old. Now, as far as in my family, my mom was diagnosed with bipolar disorder when I was in high school. So my mom was like in her late 30s. So we had went through all these different behaviors and toxicity and not knowing that she was bipolar. And it's the same with other individuals in my family. They didn't know. It wasn't until it was something major that happened, unfortunately, that they ended up in the hospital or something like that led to their diagnosis.
So how prevalent is it for it to be in the gene in the family line?
Unfortunately, very. In my family, it skipped me. But I do have some family members younger than I that they have the diagnosis. But my mom and her siblings and her mom has a diagnosis of bipolar disorder. I'm not sure if they have 1 or 2, but I know my mom has bipolar disorder 1. And the good thing about it is my mom is very open and she's all about educating. So that makes me feel better that I can talk to others about it and what I experienced, not only as a healthcare professional, but as her daughter.
Now, I'm a caregiver of my mom who suffers with bipolar schizophrenia. And I know that I have to do things differently in my own life to make sure that I protect my mental state. Because once you know that it, is in a gene or in the family somewhere, you have to be extra, extra protective of your mental space. So that's why this webinar, as well as the work that I do as a self-care advocate, is so, so important. Taking those times for relaxation, for mental dumping, for brain dumping, just, meditating, doing absolutely nothing, having those moments of stillness where you can reboot, rejuvenate your mind, your body, and your spirit. I'm going to go back over to Ashley. Ashley, let's talk about medications. Woo, let's talk about medications. So a lot of times I've seen that people will start out on medication and they start to improve. And then after they improve, they say, well, I'm better. So they stop their medications. Let's talk about it.
Yes. I've tried a range of medications. Yes, it's trial and error. I've tried medications that have varying side effects, such as making me extremely hungry, extremely tired, or having issues with my eyesight and my vision, restless legs. The list goes on and on and on. However, I've been very fortunate to work closely with my treatment team to manage my medication regimen and to overcome these side effects through other medications that will help me keep the symptoms at bay and under control.
So how important would you say that it is once you've been prescribed medications that you stick to that regimen and you stay on those medications?
Medication works well for me. In fact, I'm taking a mood stabilizer and an antipsychotic medication to treat both the bipolar and the schizophrenia symptoms. Speaking for me, the medication does wonders. It keeps the hallucinations under control. I have not heard voices in over 10 years. However, I had a range of other symptoms dealing with my mental health diagnosis, such as psychosis, delusions, and so forth and so forth. But the medication has helped me in my recovery overcome tremendous hurdles.
Good, good. And Dr. Tiffany, I'm going to ask that same question to you. What would you say to one of your clients who you prescribe the medication for them and they're doing well, and then they say, hey, my doctor said I could stop taking it? Because I've heard that so many times being a nurse, and then we see, repeat customers because they stop their medication because they feel like, oh, I'm better now, and they stop their medications. Well, how would you address that?
Tell you exactly what I tell them, but I basically say your medications, I try to explain it from a biological aspect. And we all go to the whole, if you have a headache, you take Tylenol type thing. But I let them know, if your serotonin levels are low, your dopamine levels are low, your body can't reproduce. So you have to take something to get those levels back up. Now, there's like myself, my medication is PRN. So I don't have to take it every day. I take it as needed.
Mm-hmm.
But still in all, I have to catch my symptoms when they at that. So that's something that I talk to my clients about at length every week. I have at least 4 or 5 that'll say, oh, I feel better, I stopped taking. And then when they relapse, they're wondering why. And then we got to do a med change because you're not staying consistent with this one. So now you're left. So I always try to go from a biological sense, because then they're like, oh, okay, well, that makes sense.
Okay. And I'm getting a message that your broadband is low. So sometimes you're going in and out, just so you might want to check your internet so we can hear you. Ashley, I'm going to come back over to you, and let's talk about some unhealthy mental habits. So let's talk about how necessary movement is. So I know it's unhealthy to live a sedentary life. How important is movement for someone who has received that diagnosis of mental illness?
It's critical. It goes back to my routine. Like I said, I walk daily. I'm stuck in, just doing things habitually, and it's helpful. Staying active, staying focused on not only my symptoms, but focusing on the coping signs to overcome some of the concerns I'm experiencing, such as the paranoia. When I feel paranoid, I have to ask myself sometimes, what would be the benefit of someone, spying on me? Why would I want to do X, Y, Z? So I question myself regularly when I get paranoid, or other symptoms such as getting depressed easily or getting manic. There are certain signs that I can identify when I'm manic. If I'm doing a lot of text messaging, I have to ask myself, why am I still talking about the same thing? Why am I reaching out to several people? Ashley, slow down, calm down. Let's do something else. Talk to my doctor. Maybe I need to adjust my medication. And so that's how I identify with the medication, the self-care, and the coping strategies that I use regularly.
Yes, I think that's super important. I love that you said your team, because it's a team approach. It takes more than just you, but it also takes you to take responsibility for your own mental health. So being honest with yourself, knowing like, hey, wait a minute, you just text the same thing 5 times. Hold up, what's going on with me? Having that self-talk. I love that. A lot of times that's one of the most difficult pieces. People don't really recognize when they're starting to go into crisis, and when maybe they need that medication alteration, or they need to talk to their doctor and say, hey, listen, this medication is no longer working, or I'm having side effects from this medication. What else can we try?
Can I add something?
Yeah, sure.
Also, I've learned from experience, I cannot rely wholeheartedly on the medication. Like that saying goes, there's no magic pill. I have to be mindful of my warning signs, my triggers, and how to manage. And that's why I take therapy so seriously as part of my regimen to maintain, because I have to open up and express myself and talk about my stressors, because this is an invisible illness that is stress induced.
Yeah. Another unhealthy mental habit is sleep deprivation. So, Dr. Tiffany Zachary, let's talk about sleep and how sleep has an impact on your mental health.
I could speak personally from that. Having a toddler and being a single mom and working all day. Sometimes I don't go to bed till 12, 1 o'clock, depending on if I have some work to do and I get off. And that definitely plays a part on your mental health because you're irritable. And you may have issues concentrating and things like that. Because at one point I was like, oh, my head is hurting because I don't have my glasses on. No, it's because I'm trying to focus so much during the day, trying to get back to myself because I didn't get enough sleep. And everybody doesn't need 8 hours. I think that's a myth. Some people can go off for 4 or 5 hours of sleep and be fine. So you got to do what's best for you. And you also have to pay attention to your daily regimen, because my job may not be as stressful as yours. So I could run off for 4 hours of sleep and be okay. So you have to make sure that you get the amount of rest that is adequate for you, and it goes along with your medication regimen as well. Because, for instance, if you're bipolar and you're on Seroquel, you have to sleep that off. You can't say, oh, I'm going to take my Seroquel at 12 and I got to get up at 5. It's not going to work.
Yes, I think thank you for bringing that out. That's important to know the life of your medication that you're taking as well. But I need my 8 hours, Dr. Tiffany. I am that person. I need my 8. So if I go to sleep at 12, I'm not getting up. I'm not moving until 8. I'm telling you, I will snooze and go back until I get the rest of my 8. I need my 8. So I teach at least 8 hours of sleep. But you're right. Everybody functions differently. Some people can function off of 4 or 6. I would be a basket case. No, it's not enough. And that's
I
not
think
enough
naps
coffee.
are good too. People don't like to take naps, but naps will rejuvenate you during the day. Even if it's 10, 15 minutes, it doesn't have to be long, just for you to get back to it and get your mind refocused.
Absolutely. And I always encourage people to take at least 15 minutes. Do it in 15-minute increments so you don't put yourself into that next realm of sleep. And then you wake up from a nap and you're like, why do I feel more tired? So I always say like those 15, 30, 45 or an hour. My problem is if I lay down, I'm sleeping for like 2 hours. Like after I had the 8, right? We all can relate to that. But that's just your body telling you, talking to you, hey, it's putting you in that red zone, shut it down. You need to stop. So we have to be very, very cognizant of what our body tells us as well. So the next one is staying in unhealthy relationships is unhealthy for your mental habits. Ashley, you want to touch on that one?
Yes, because my support system is crucial to my wellness.
Yeah.
I do have my caregiver, my stepfather, who is out of state, back in California. I have my family and friends that are close to me, as well as another state as well. And so I have to surround myself with positive energy. And what that looks like is people that are hopeful about my recovery, hopeful about my goals, and that are encouraging. And if I'm not in a positive environment, I have to create one by separating myself from people that are toxic, talking negatively. And so if you go to my Facebook page, in which we're linked to, I talk a lot about motivational speakers, Les Brown, Eric Thomas. I wake up listening to them because I need to reprogram myself to start off on a positive baseline. And so negative relationships can be triggers.
Yeah.
Those individuals that are not only negative, but want to bring you down because they're in a bad place.
Yes, absolutely, absolutely. And it's important to have people in your space that know when you're not right. And they check you on it. And they're like, what's going on with you today? You're not yourself. What's going on? And so that's going to help you to recognize, hey, am I going into a crisis? Or do I need my medicine adjusted? If somebody is around you and they're like not letting you know when something's not right with you, that's not people you want to be around at all.
Yes, and some of those questions that people in my circle may say that indicate I need to work on myself includes, Ashley, you look stressed out. Ashley, you're not acting like yourself. Do you need to take a break? Do you need to go to a respite center, which in Georgia is a place away from home between your house and the hospital? It's a community house for those with a mental health diagnosis where they can stay and regroup and engage in group activities with other peers who are also in recovery.
And who understand what you're going through as well. Yes, that's very important. And I know like the social groups, social interaction is also another way to guard your mental health, not just social media, but actually having live interactions with people. That's another way to keep your mental state healthy. So all of us, again, for anybody who's just tuning in, we're talking about mental health matters. This is a webinar series that we're hosting throughout this week. We started last night talking about forgiveness and healing. Tonight, we're talking about managing mental illnesses. And so we have Ashley Smith and Dr. Tiffany Zachary. Ashley is from Atlanta, Georgia, and Dr. Tiffany is from Louisiana. So this is a global conversation that we're having because it can affect anyone, men, women, no matter what your race, no matter what your religion, your ethnicity, it does not matter. Any of us at any point can have our mental health affected. Some of the things that can affect that are stress. Like if you are so stressed out, you can have a mental health crisis. And before you know it, now you have a mental illness and you don't know where it came from. So that's why it's so important to perform that self-care, not just, oh, I'm going on an annual vacation or, oh, I'm going to get 8 hours of sleep. No, every single day we need to really be touching base with who we are, taking time to relax, taking time to reboot, time to brain dump, time to restore and refocus. I always say we're like computers. If you never ever shut that computer down, it's going to overheat. It's going to burn out. It's going to shut down whether you want it to or not because it can't continue to just run. It needs that reboot period. It needs that time to shut down. Same thing with us. We need time to shut down, reboot, cool off, brain dump, so that we can regain focus, we can regain clarity, and we can be the best version of ourselves. But we have to be honest with ourselves in knowing what we need to do each day for ourselves, whether that be do some self-care, whether that be take a medication that has been prescribed for us. And there's nothing wrong with that. These conversations are to take the stigma out about mental illness and about your mental health. It is imperative that we take care of our whole person mentally, physically, emotionally. So I'm going to go back to Dr. Tiffany and talk to you about some natural relief. So I know like vitamin B is one of the big vitamins for aiding in combating stress or decreasing stress and combating things like OCD. So let's talk about natural relief. How do you feel about trying natural relief for mental health disorders first before going into medication?
Can I say something right quick
Sure.
about the last thing that you stated? It's very critical that anybody who believes they have a diagnosis or who has been diagnosed, that they are around individuals who believe that mental health is an issue, that mental illness does exist. I have a lot of clients who come in and that prevents them from coming to therapy or even going to a doctor because their moms or their husbands or wives tell them nothing is wrong with you, pray about it or this, that, and the third. And it's not always that easy. Some mental illnesses are very severe. And if you don't take care of yourself, not only are you putting yourself in harm's way, but other people as well. And to go back to what you were saying about holistic regimens, I'm big on essential oils. I have diffusers throughout my house. I have one.
Do too. I love them.
And they have, for anybody who's watching, my client, she has a little necklace pendant that you can put the essential oils in it. They also have the bracelets, the rings, and things like that if you don't want to be so obvious about what you're doing to calm down and things of that nature. So I'm big on essential oils. Anything with aromatherapy, that's my thing. We also have weighted blankets for individuals who have anxiety. There are different sizes, so be careful when you buy one because it may be too heavy. It may make you feel like you're suffocating. But if you get the right size, the right feel, it could really be a benefit to you. So,
yes, and now they have the weighted blankets that are lavender infused, so it helps to calm you. I've seen that work wonders on like some of my patients who are really, really anxious and they just were restless in bed. So we advise their families, why don't you try one of the weighted blankets? Put them on them, and the people are sleeping like babies. And I'm like, wow, do I just want one just to sleep really good and get my 8 hours in or what? But they really do work, and now they're lavender infused. So definitely aromatherapy. I love vitamin B6 and vitamin B8 in particular. Vitamin B8 that helps to decrease your stress, combat OCD, that obsessive compulsive disorder. I got a little bit. I like my pillows a certain way, y'all. I like my pillows. But we're talking about excessiveness. We're not talking about little quirks here or there. We're talking about excessive behaviors. We're not talking about, oh, I like my pillows a certain way like me. I like to joke and say I'm a little OCD.
That you have what do you call it? A regimen before bed.
Yeah.
I tell my clients all the time, especially if you have mood disorders and things like that, you can't just say I'm going to bed because your thoughts are still racing. You gotta calm down. It may be go get in a hot shower or listen to your music or go meditate, something like that. And in the morning as well, I tell my clients before you hop out of the bed, take a moment and breathe. It's no need for you to rush, because if you start your day like that, you're going to continue when you're leaving out the house, you get in traffic, you're rushing. So it's important of how you start your day and how you end your day, no matter if you have a mental illness or not.
Absolutely. I always say prepare for sleep. We prepare for our appointments. We prepare for our meals. Why don't we prepare for sleep? It's one of the most important times of the day. I say when you go into your room, what does your brain say to you? Oh, it's turn up time. She's about to start working. She's about to watch TV. She's about to do everything else but rest. Or when you walk into your place of sleep, does your brain say, oh, she's shutting it down for the night? Like I fall asleep like that, because that's when I go in my room, it's purposeful for me to go to bed, and I get the best sleep like that. I make sure also that it's a cool environment, because if you're hot, you're not going to be rested. You're going to be restless. So making sure that, your neck is not elevated too much or your neck is not too low. Otherwise, you're going to wake up with that crook in your neck. So prepare, get the pillow that's comfortable for you, get the blankets that are comfortable. It's also noted that sleeping in the nude is more beneficial for your health than sleeping with clothes because of the chemical releases in your body. So preparing for sleep, she's like, so preparing for sleep is very, very important. Also, iron. Iron helps to combat depression. It also helps with your mental focus. Vitamin D, especially like in the winter months, seasonal depression is huge. I hear all of my mental wellness professionals talk about like they're bombarded in the wintertime because we have less sunlight. So that sunlight, vitamin D is super, super important. Getting outside, getting some sunlight, even if it's for just 10, 15 minutes every day, the little bit that we may have, that's imperative. If not, please take a vitamin D, supplement. And Americans especially, we are vitamin D deficient. So when you go to your doctor for that physical, ask your doctor, hey, can you check my vitamin levels? Check and see, how's my iron? How's my vitamin D? Because those are the things that you could be using to ward off a mental disorder. Also, folinic acid, not folic acid, but folinic acid, that reduces mental health issues because of gene mutation. So again, we were talking earlier about genes and how it can run in a family line. Like I know schizophrenia runs in my family. So I've had aunts that have had schizophrenia that were diagnosed very early on when they were young, and they were in and out of facilities. And so it's important to know that information. I know back in the day we would say, hey, what goes on in this house stays in this house. You don't talk about it. But we need to talk about it now, because we need to know, are we predisposed to those disorders, so that we can know how to better take care of ourselves before we get to the point where we're diagnosed with a mental disorder. So that, and then the last one is an amino acid, L-theanine. That's another one that's really good. It promotes calmness. It's known to be the alert relaxation medication. It decreases stress, decreases anxiety. It's found in green tea, but you would have to drink a lot of green tea to get the full effect, because it's recommended that you have 150 to 250 milligrams each day. So a cup of green tea only has like 6 to 10 milligrams per cup. So you have to drink a whole lot of green tea, but I love my green tea. It does help to calm you some. You can get little doses of it through the green tea, but it's called L-theanine. That's an amino acid that helps also, because it slows down. We have 2 different hormones in our body, the GABA and then the glutamate. And so those 2, they're like a seesaw. They go up and down. When one is up, the other one's down. And so that L-theanine, it helps to slow down the glutamate production, allowing that GABA to go up. And then that's when the relaxation happens. So just knowing your body, number one, knowing what your triggers are, like Ashley talked about, making sure that you are listening to your body. If you feel like something is wrong, don't be afraid to go to a doctor, get it checked out, talk to somebody. What's the worst that can happen? They tell you it's okay, it's nothing, maybe you just need some rest. Okay, do what you need to do. So I'm going to go back to Ashley now. So Ashley, you have a book over there. I want to talk about your book. Tell us a
Yes,
little bit about your book and what inspired you to write that book.
yes, my book is called Coping Takes Work. It's available on Amazon. This is my second self-published book, and it talks about how to bounce back after institutionalization, specifically hospitalization. I have been hospitalized twice in over 13 years of recovery. Again, I was diagnosed at age 20, now I'm 33 years old. And the whole message behind this book is that because of the severity of mental illness, specifically schizophrenia, hospitalization may not be avoided, but you can bounce back and bounce back stronger through coping strategies. So it's all about mastering recovery and resiliency. That's what Coping Takes Work is about.
Awesome. And where can everybody get that book?
It's on Amazon. Again, the title is Coping Takes Work. And my name is Ashley Smith. I am a peer counselor, otherwise known as a certified peer specialist. And I talk about a range of coping skills as well as a crisis plan and the benefits of therapy.
Awesome. Awesome. We're going to come back to you and find out again more about where they can get your book at the end and get your final words to our listening audience. So we have a lot of people tuned in, and this is a very, very important topic. And, you know, talking about medication, you said something about medication again. Dr. Tiffany, have you noticed that when someone stops taking their medication, that when they have to get put back on, it requires a higher dose in order
Oh,
to get them back to the baseline? Talk to us about
yeah, that's like I said earlier, they relapse.
that. Mhm.
So your body is fighting to get back to a stabilization, but then it's also having to combat, well, I was on this medicine, now I'm on a different medicine to try to up this level, now it's this level. And that's why I say I try to always educate on a biological level, because people look at medicines, but I'm like, you have to look at what the medicine is triggering and what
Mhm.
your mental illness is, because every medication does something different. So, and like Ashley said, some medications can make your symptoms worse. So that also there are tests that your doctor can do to know, okay, well, you'll do best in this class of medication instead of all this trial and error and things like that. And that's another reason why people don't like to take medication, because it's like, well, I done been on 5 medicines, nothing is working. But you also have to realize too, it may take 2, 3 to 4 weeks, depending on your dosage. You know, your doctor may go up and down on it, but that's why it's key for you to have a doctor that you're in tune with and they know everything about you, not just mentally, but biologically, because you can have some other issues like thyroid and things like that that can play a part.
Absolutely. And medicine is not an exact science. I mean, doctors are going to try, but doctors are human too. So we don't know in the medical field until you try the medication whether it's going to work or not. So that's why it's important to stay consistent with that same person, like you said, who knows your history, who knows what they've tried, who knows your symptoms. And when they see you, you can try to mask those symptoms all you want, but they're going to read right through it because they're used to seeing you and they know exactly like who you are and everything that they've dealt with you over the years. So it's important to have consistency all the way through.
And you need
So
to also have a physician or like yourself, like a nurse that can call you on it. I think
yeah,
another problem in mental health is professionals are afraid. Like I call my clients real quick because you need to use it as a crutch. And I'm like, okay, but you got to understand sadness is also natural. You're human. You're going to have some sadness. You're going to have some irritability. You got to learn how to cope through certain things. Everything can't be, oh, my depression, oh, my anxiety. Are you causing yourself stress? Or is it really your mental illness? And I love my doctor because he'll call me on it quick. He like, look, you need to leave that job, or you need to get some rest, or you need to cut back, Tiffany, cut it out. And I'm like, okay, you're right. You need to cut it out.
right, you're right, exactly. So again, having that support system is major. So we're talking about managing mental illness, having a good support system, having a daily routine that you stick with. Ashley, did you want to say something?
Yes, I want to add on that building trust and maintaining that trust relationship is crucial to the treatment team. It's important that you state what are your fears about medication, what are the side effects, and staying with your doctor or therapist as long as you can so that you can build that bond and trust and understanding, so that your questions could be addressed, so that you can manage and overcome whatever is preventing you from getting the best care that you possibly can get. However, I understand that some people do not have health insurance. Some people do not have transportation. Some people cannot afford the medication.
Mm-hmm.
That's why it's so important to take advantage of programs and patient assistance programs when you can, and also to monitor yourself by recording signs or symptoms or keeping some kind of record and to share with your doctor and your therapist.
Good points. Good points. Absolutely. And let's talk to the caregiver right now. Whew, I'm a caregiver. So it can be a struggle. And sometimes it's like, oh, you're being mean. No, I'm not being mean, but I understand and I've seen where you were and where you are now. And I don't want you to go back to that place where you had to go to the hospital and be admitted or see you spiral down or lose that weight or have those false beliefs or feel paranoid. I don't want to see you like that. And I understand that your medication is working for you. Let's talk to the caregiver about ways that they can be supportive, but then also guard their own mental health at the same time while being a caregiver. Either one of you, whoever wants to jump in.
Yes, I'll go first.
Okay.
I have my stepfather as my caregiver. Even though he is out of state, we have a very close bond. I trust him so much that he'll be direct with me and he'll tell me when he thinks that I need some extra attention in my treatment. He'll ask me how I'm doing regularly. He'll tell me my selfies, my eyes don't look well. So we have a very direct, open conversation. For caregivers, I specifically suggest that you manage your own self-care, that you maintain trust between you and the individual who has the diagnosis, and just try to embrace recovery to the by giving options. By example, like you mentioned, you're a caregiver for your mother and how it runs in your family, Sheree, that you may say, hey, I see that you're struggling right now, or see that you're not doing as well as you used to. What could we do? What are some alternatives? What worked in the past? Did the hospitalization work? Did change your medication work? So that we as people in recovery have to have independence in making decisions and can help and support the decision-making process. It's very important to have that trust and those options available.
Yeah, and that's a point that I always make even to my mom. Like ultimately you are responsible for your mental well-being. It's really not anybody else's responsibility. I'm here as a support, not to tell you what you need to do because you already know. You know you need to eat nutritious meals. You know you need adequate rest. You know you need movement. You know you have to make sure your medications are, you're taking the medications prescribed. And so as a caregiver, I find that it's important sometimes to have to step back and take a mental break for myself and not get wrapped up in the whole emotional feeling about it, but actually kind of step back, take that break and say, you know what? Ultimately, I have to protect my mental health while I'm supporting you. Dr. Zachary, you want to talk about that?
One of the key things for me, and it's in every treatment plan that I do for my clients, is building rapport and trust. That's what we got to establish at the first appointment, because if we don't have that, there's no need for us to even continue, because I won't get anywhere with you. And that goes the same for a caregiver. My mom always tell me, I'm not one of your clients. I'm like, you go, mama. I'm not trying. I understand you, my mama. And that's a big thing when you're the child and you have a parent who has a mental illness, because now they feel like, oh, you're trying to tell me what to do.
Yeah.
No, I'm just trying to identify that, look, I see what's going on and I know where it can go. So I'm trying to prevent you going into the hospital, things like that. So I'm a part of her treatment team. I always ask, if she get a med change, I want to know why. If she get a new therapist, I want to know why. If the doctor's saying, oh, X, Y, I need to know so that I can reinforce that. Everybody has to be on one page. You can't just go off of what mom says, because she might not tell you everything. Because people, individuals, they could be a little manipulative because they don't want you to know, so you don't hold them accountable sometimes because they're having a hard time dealing with it. They feel disabled. And I understand that, everybody wants to feel like they're 100% all the time. So everybody has to be on one accord. And I think, if you go into the doctor's office with your mom and doctor looking at you and mom look at the doctor, then you can say, well, that's what the doctor said. I didn't say it. So I put it back on the doctor. I didn't say it, mama, the doctor said it. I'm just here to reinforce. So don't take all the pressure. That's why they have a therapist, a doctor, a nurse, whoever it may be, like Ashley said, on their treatment team. Don't put it all on yourself, because then you will drive a wedge in between you and your family member, and then they won't say anything. They'll shut down, and then where do you go from there?
Absolutely, absolutely. So we're gonna wrap up. This has been an amazing conversation. I think we've given everybody like a whole lot of information to walk away with, and just giving them something to think about. At any point, we never know when it could be one of us that, has a mental health crisis. It can happen at any time. Moms, dads, caregivers, it doesn't matter. It has no face. Mental illness, mental disorders have no face. It can happen to anybody at any time. So if someone is in crisis, and you think that they are potentially a harm to themselves, then we encourage you to call 911. That's what you want to do. Call 911. There can be an emergency petition to get the person the help that they need, especially if you think that they are a potential harm to themselves or others. You want to call 911. NAMI, which is the National Association of Mental Illness, they have a crisis hotline. You can text their crisis hotline. You can text the word NAMI, N-A-M-I, to 741-741, and you'll get a crisis counselor by just doing that text. If a person is suicidal, you can also call the prevention line, which is 800-273-TALK. So that's 800-273-8255. So those are all numbers that can be used nationally. So you don't have to be in a certain zip code in order to use those resources. So I want to thank both of you. Thank you, Ashley. Thank you, Dr. Tiffany Zachary, for sharing your stories and your truths and being so real with us about your life and how you are coping and managing your own mental disorders. I'm going to start with Ashley. Tell us again how everyone can stay in contact with you if they have questions or they need a peer counselor or they want to get your book.
Yes. First, to learn more about my recovery experience, you can go to my blog, which is called Overcoming Schizophrenia. The address is overcoming schizophrenia.blogspot.com. To get access to my book, Coping Takes Work, go to Amazon. Again, it's called Coping Takes Work. Again, my name is Ashley Smith. I'm in Atlanta. I'm a peer counselor, self-published author, and a speaker and mental health advocate. Thank you so much for having me on this webinar.
You are so welcome. And just give us a last bit of advice for anyone about managing mental illnesses.
Yes, engage in self-care. Therapy does wonders if the medication is not always as supportive as you want it to be. Purchase my book, Coping Takes Work. Get involved in NAMI, the National Alliance of Mental Illness, for free support groups for you and your family and caregivers. Thank you.
Thank you so much. Thank you. That's Ashley Smith. Everybody give her a hand clap out of Atlanta, Georgia. Thank you so much for pouring into the audience that's listening. And thank you so much for spending time with us this evening. Finally, we're going to go over to Dr. Tiffany Zachary. Tell us again how everybody can stay in touch with you. If someone is in your area and they want to utilize your services, tell everybody how they can stay in contact with you. If you have any services or products that you want to share, please feel free to do so.
I'm located in Louisiana. I'm also licensed in Texas. So if you are in need of one-on-one therapy, I also work with universities. I have a PhD in higher ed. And I wanted to add what you said about NAMI. Majority of the campuses, universities, they have free therapy and also NAMIs on campus. So that's a good resource for college students. I'm Dr. Tiffany Zachary across social media, Instagram, Facebook, Twitter, and my website, drtiffanyzachary.com. My last name is Zachery. You can also find me on Psychology Today and Therapy for Black Girls.
Awesome. Give her a hand clap, everybody. Awesome, awesome information. Thank you so much. You both are so amazing. I just want to tell everybody, I reached out to these two ladies. We really don't know each other. And so I reached out to my Facebook family and said, hey, where are my mental health professionals? And I got like hundreds, when I say hundreds of recommendations. I went to every single one and I strategically picked people that were in different states so that we could touch people all over and different walks of life. And when I reached out to you, I didn't even know that either one of you even suffer from mental disorders. So it was really aligned by God, I say, because this was a conversation we definitely need to have more often. And just looking at both of you, you never know what somebody else is going through. You never know what else somebody is undergoing. And so we're taking the stigma out of the belief that there's something wrong with admitting that you need some help with your mental health. We're taking the stigma out of the fact that, hey, therapy is okay. Especially in the African American community, we don't want to go to a therapist. We think, oh, that makes you crazy. No, that makes you smart, it makes you intelligent, it makes you protective of your own health. That is self-care. If you need someone to talk to, if you feel things aren't right, it's okay to get some help to be whole. So thank you, both of you ladies, Dr. Tiffany Zachary from Louisiana and Ashley Smith from Atlanta, Georgia. Thank you so much for spending this evening with us. We have some folks on our live Zoom who are saying self-care is a necessity. That is Dee Bolden, Joanna Samuel, all the way from St. Croix. She said this is an awesome conversation. We have Rhonda Wood. Hi, Rhonda. She said, hand claps, phenomenal job, ladies. So definitely we're having an impact with this webinar series. Please, everybody, tune in for the rest of this week, 8:30 p.m. Eastern Standard Time. Tomorrow, we're going to be talking about healthy relationships. So another part of, your mental health is about the relationships that you have. So we're going to have the Cheryl Wood, my twin power. Cheryl Wood is going to be talking about relationships, as well as Dr. Roz. So Dr. Roz Aker, she's going to be on here. Both of them are from the DMV, and we're going to have a good conversation again tomorrow. So please tune in. If you missed a part of this, you can watch the replays. It will be on my social media page at Chere M. Goode. And I'm sure that these ladies will be sharing it on their social media pages as well. And then I will be sharing a YouTube link as well so that we can get this message across the globe. Thank you again, ladies. Have a great evening. Dr. Zachary, did you have any closing comments that you wanted to give anyone?
To anybody out there that thinks they have a diagnosis or you have a diagnosis, just like Ms. Goode said, therapy is for any and everybody, even pastors. Everybody needs somebody outside of themselves. You can't do it by yourself. My clients say I'm a paid friend. Whatever you got to do to get your help, call it how you want it, just get it done.
Absolutely. I love it. What a great way to end tonight's series. We will see you all tomorrow for our next Mental Health Matters webinar series. And talking about pastors, we have a pastor who's actually going to be one of our mental health specialists on Thursday. So make sure you tune in. Good night, everybody.